Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our UM campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of March 2026 includes stories about new research to uncover gestational diabetes. UM dental students donate oral health kits to Siloam Mission. Radi's Women in Science program honored at the Manitoba Legislature, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. Students from the Dr. Gerald Nisnik College of Dentistry handed out oral hygiene products and shared dental care tips with people at Siloam Mission on a Saturday in February. The dental students and dental hygiene students gave away oral hygiene kits that included a toothbrush, toothpaste, and dental floss to those in need. The students put together 100 kits from donations they collected, many from local dental offices. Lala Rook, a second-year dental student and Smile More's Director of Corporate Relations, said there was a positive reaction to the oral hygiene kits they were handing out.
We had a lot of eager individuals coming up to our table, excited to receive a toothbrush and a toothpaste.
The effort was organized by Smile More, a Manitoba Dental Students Association affiliated student group that was started last year. Not only is it beneficial to give back to the community, Rook said that being part of Smile More is also a learning experience.
We're dentists second, but I feel we're educators first. When we have patients coming in, we're not just operating on them, we're informing them about how to take care of their oral health, the impacts of not taking care of the oral health. And through volunteering at these events, we're learning how to be better educators, and I feel that's a really essential skill set that we can develop right now as dental students before we step out into the real world, and we're working with patients every day. Earlier this year, Smile More members put together 100 oral hygiene kits for Agape Table, a local organization dedicated to feeding those in need. The Radi Faculty of Health Sciences Women in Science Development Outreach and Mentorship, or WISDOM program, was honored at the Manitoba Legislative Assembly on March 4th by Minister of Families Nahanni Fontaine. A group of students from WISDOM's Learner Group were invited to the assembly and received a framed copy of Fontaine's speech. The Learner Group is made up of 9 students from across the Radi Faculty of Health Sciences, including the Colleges of Pharmacy, Rehabilitation Sciences, and the Max Radi College of Medicine. The group also received a legislative tour and met privately with Fontaine, Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara, and Minister of Advanced Education and Training, Renee Cable. Fontaine was inspired to honor WISDOM after meeting the Learner Group in January at a retreat on Bannatyne campus.
When I met with the powerful women of WISDOM earlier this year, I did not just see researchers and mentors. I saw architects of a new scientific culture in Manitoba, one rooted in equity, collaboration, and courage. They are leading cutting-edge research, they're mentoring the next generation, they're challenging biases, and Manitoba is stronger because of them. I am so incredibly proud and honored to know each and every one of you. I'm asking my colleagues to join me in celebrating these bold, brilliant, barrier-breaking women in sciences. Miigwech.
Health professionals, faculty, and students gathered at the University of Manitoba's Bannatyne campus on March 11, 2026 for the first French bilingual community of practice. The initiative is a collaboration between the Radi Faculty of Health Sciences, Shared Health, Soins Communs, and Santé en Français. Nathalie Gagne, Program and Operation Manager at Santé en Français, says building community is at the heart of the new initiative.
The idea is to bring bilingual students and to have them interact with professionals, bilingual professionals, and maybe try to establish a connection, maybe try to see if there's a possibility of giving them resources, giving them opportunities to get together and to speak French together in relation to their field, and maybe mentorship opportunities, maybe eventual practicum opportunities in French for these students. And so it's to bring these people together and try to build this synergy and try to build this community where it's less isolating. Because when you're a student alone, you're bilingual, you're in an English program, it can be very isolating. And regardless of where you're working as a professional in the big complex health field where most everything around you is going to be in English, that can also be isolating. So it's just to give this sense of community to bilingual people.
Dr. Reg Urbanowski, Dean of the College of Rehabilitation Sciences, shared what he hopes the impact will be.
I'm hoping that it will be able to offer students the opportunity to learn in a bilingual environment for those students that wish to. And I'm hoping that then patients or clients who are bilingual, who want to receive bilingual healthcare services, will be able to, because we've now increased the number of providers who can provide that bilingual service. Let's come together, let's share, and let's grow a bilingual community of practice that's vibrant.
For more information and to participate, please email mmoquin@santeenfrancais.com. Experts don't fully understand what triggers gestational diabetes, but Dr. Vern Dolinsky and his team are working to change that. Dolinsky, a professor of pharmacology and therapeutics at the Max Rady College of Medicine, has received $450,000 from Diabetes Canada to fund the next phase of his research. He is focused on uncovering what goes wrong in the body during gestational diabetes.
One of the key things we, as well as others, have found is actually a key feature of gestational diabetes seems to be mitochondrial dysfunction. Okay, so, like I said, there's a lot of energy demands, and like this project specifically is looking at the cells in your body that produce insulin.
Dolinsky and his team discovered that a protein called SIRT3 plays a key role in keeping mitochondria healthy. Dolinsky and his team will be studying mice that lack SIRT3 in their beta cells. He will be tracking how this affects the mice's blood sugar levels, insulin production, and overall energy use during pregnancy. They will also be testing a form of vitamin B3, which boosts SIRT3 activity to determine whether it can improve blood sugar control during pregnancy. Dolinsky believes his lab is the only one in the world working on SIRT3 and pregnancy.
It's a little bit niche, I guess, in that a lot of people don't study pregnancy. It's a hard thing to study. So that's probably why a lot of people aren't working in this space.
Dr. Catherine Bilyeu recently took on the role of Department Head of Physical Therapy at the College of Rehabilitation Sciences. This has been a true homecoming for Bilyeu, who was born in Winnipeg and graduated from UM's physical therapy program in 1994, before moving to Colorado, where she worked both clinically and as Associate Director of Clinical Education at the University of Colorado. She said she's excited to give back to the program that shaped her as a physiotherapist.
And there really was sort of this strange comfort in making the leap into this position and coming back to a program that still has some familiar components and values and approaches to education that I remember as a student. And they were already starting to work on and recognize the need to work on some things that I really love focusing on, and that's expand the program in terms of the diversity of the students and the faculty, so we can really better meet the needs of our students as learners and our patients through representation.
Dr. Philip Berger has fought for equitable healthcare for marginalized people for more than 50 years. The UM alumnus sat down for an insightful Q&A session with Dr. Peter Nickerson, Vice Provost, Health Sciences, and Dean of the Max Rady College of Medicine. The talk took place at the Max Rady College of Medicine Teacher Recognition and Manitoba Medical Students Association Awards Dinner on February 26th at the Canadian Museum for Human Rights. Berger shared stories of his advocacy work over the years, which includes establishing HIV/AIDS patient care in Toronto, advocating for the benefits of methadone in treating heroin addiction, and helping restore health coverage for 100,000 refugees. Berger told the audience that medical schools should drive empathy into the minds of students.
That when I'm looking at a patient in their office, they should look beyond the patient. They should actually look through the patient's own eyes of that patient. If they look through the patient's eyes, they'll be able to more readily see the political and social conditions, the legal, human rights, environmental, gender-based, race-based conditions that make people sick or impede their recovery.
Berger concluded the Q&A with advice to the many medical students in the room.
Well, I think long-term success in medicine is more related to integrating into medical practice virtues of discipline, rigor, imagination, creativity, smarts, kindness, and above all, humility. And those virtues, if you can integrate them, will go a long way to securing a professional career that is satisfying and a life that gives you contentment and joy.
The awards dinner featured the presentation of 21 awards recognizing excellence in medical school teaching. 4 awards were also presented to medical students who have distinguished themselves in the categories of global health, citizenship, community service, and leadership. Students from the University of Manitoba's Rady Faculty of Health Sciences traveled to more than 90 rural and remote communities across Manitoba to support local healthcare services. These placements give learners in medicine, nursing, pharmacy, rehabilitation sciences, and dentistry the opportunity to learn alongside healthcare professionals in real-world settings. Lindsay Gundrum, a fourth-year midwifery student in the College of Nursing, is currently completing her placement in Morden and Winkler. She shares how the Rady faculty has supported her and what her experience has been like in rural placements.
They fund your accommodations for you and put you up, and you don't have to worry about any of that financially at all. So you just really have to consider like what you need, like personally, and like groceries and stuff you pay for yourself. They also cover travel, like to your placements, so anything that's over 40 kilometers, they cover that as well. And then if you're above the 52nd parallel, like so you have northern placements, then they would give you like reimburse some of your expenses for groceries. Like my favorite part in general for like my midwifery placements is that you have a smaller team of midwives to work with, and you just get to know everybody super well. In Boundary Trails, and especially the interprofessional collaboration there is like phenomenal. I'm really hoping to, after this experience, to be able to get a job here and work here. Honestly, like it's been so great, and the midwives are so welcoming, and they're very encouraging of me to come back and work here as well. So that's been super nice.
The Office of Rural and Remote Learning Experiences is seeking community support, from financial contributions to welcome packages to helping students connect with local activities. They're encouraging community leaders to reach out and explore ways to make each student stay positive, supported, and welcoming. For more information, email rady.ruralremoteplacements@umanitoba.ca. Thanks for joining us today. Rady-US is heard monthly on UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our new UM Today news site at umtoday.ca.